Hey, what's up YouTube? Welcome back to Intuition. In today's video, we're going to be talking about the science of the George Floyd case. We're going to be answering some questions and some of the science that I learned from watching this case, because I think every tragedy is a learning opportunity. And this case was definitely a tragedy, and I definitely hope that justice is served. So we're going to answer 3 science questions about the George Floyd case. All right, let's begin. Question number 1. Question number 1 says, it is well known that a high blood concentration of opioids can be fatal. Through what physiological mechanism do opioids cause death? Okay, so this is a pharmacy question, right? This is definitely a question that every pharmacist should know the answer to. So let's go ahead and look at the answer choices to see which answer is correct. Answer choice A says, by inducing severe numbness through inhibition of pain and tactile signals. Definitely incorrect, right? Opioids doesn't kill you by making you numb. Opioids are analgesics, they're not anesthetics. So this answer is incorrect. Answer choice B says, by inducing respiratory depression through activation of mu receptors in the brainstem. Exactly, that's the correct answer. The part of the brain that's responsible for regulating your breathing is in the brainstem, right? That will be the pons and the medulla in the brainstem. Because breathing is not something that you have to remember to do. The brain does that automatically. And it's the brainstem that allows you to continue to breathe without you having to remember to breathe. And this is the unfortunate impact of opioids, is that it suppresses this part of the brain. And in a sense, what opioids do is that it makes a person forget to breathe. It lowers the breathing rate and sends a person into a coma, which eventually will cause them to die. And that's how opioids can be fatal. So the correct answer will be answer choice B. And if you look at answer choice C, it's a similar answer, but that's the incorrect answer because it says that it inhibits mu receptors. But the correct answer is that it activates mu receptors. And of course, answer choice D is incorrect because opioids are not beta blockers, right? So opioids do not inhibit beta receptors. So D is incorrect as well, and the correct answer is B. All right, let's go on to question number 2. Question number 2 says, a 65-year-old male with a 10-year history of cardiovascular disease has significant narrowing of his coronary arteries. Yet, the patient maintains sufficient blood flow to his heart muscle. What allows for this phenomenon? This question says that this patient has cardiovascular disease due to the fact that his coronary arteries are narrow, which means that there's plaque buildup in the arteries and there's less blood getting through those arteries because they're kind of clogged up. Yet, this patient feels okay. The patient is still getting enough blood flow to his heart. So how is it that a patient with clogged arteries can still get blood flow to where it needs to go? Let's look at the answer choices. Answer choice A says coronary collaterals. That's correct. This is something that I learned from watching this case. And what coronary collaterals are, these are new blood vessels that the heart develops and build up over a period of time to make up for the clogged arteries. The heart is a fascinating organ. So what it does is it makes new blood vessels so that blood can still get to where it needs to be, even though you have clogged up arteries in the heart. And this is something that happens over a period of time. And that would be the correct answer. And if you look at the other answer choices, they're all incorrect because B says low blood pressure, but a low blood pressure means that the heart is not pumping hard enough to push enough blood out to get to the different tissues of the body, right? So low blood pressure would be incorrect. The issue in cardiovascular disease, the blood vessels are clogged up. What really needs to happen is to either unclog those arteries or generate new arteries for blood to flow. So the correct answer is A, coronary collaterals. Let's go on to question number 3. Question number 3 says, a patient who suddenly stopped breathing was found to have an arterial PCO2 level of 78 millimeters of mercury. Approximately how long has it been since the patient took his or her last breath? Assume that the patient's initial PCO2 level was 40 millimeters of mercury. Okay, so PCO2, so that's talking about the pressure of carbon dioxide in the arteries. This is something that we've covered before in this channel. We know that the normal level of carbon dioxide in the arteries is between 35 to 45 millimeters of mercury. But in this case, this patient suddenly stopped breathing, and when the carbon dioxide level was tested, it was up to 78 millimeters of mercury. And now we're being asked, how long has it been since the patient took his or her last breath? Well, here is something that I learned from this case, which came from Dr. Tobin. He made it very clear the carbon dioxide level increases at a given rate of 5 millimeters of mercury per minute. And that's something that I picked up from watching this trial. So 5 millimeters of mercury per minute is how the pressure of carbon dioxide is going to increase in the arteries. So once we know that, we can easily predict how long it's been since this patient took his last breath, because his carbon dioxide level started off at 40 and now it's up to 78. So it has increased by an amount of 38 millimeters of mercury. And since we know that the carbon dioxide level is going to increase by 5 millimeters of mercury per minute, we just need to divide 38 by 5, and this gives us a time of a little bit over 7 minutes. So approximately 8 minutes. And the correct answer is going to be answer choice B, 8 minutes. All right, so there you have it. Let me know if you guys have been watching this trial. Let me know what you guys think about it. If you have an opinion, go ahead and share it in the comment section below. If you have any questions about what we covered here on this episode, go ahead and leave it in the comment as well. And as always, I encourage you guys to like, share, and subscribe. And I'll see you in the next one. Bye-bye.